Hello and welcome to the Downsized Live today from the Celebrity Reflection in the middle of the Caribbean. Of course, Lorraine and I are on a cruise because that's what we do. But I did want to hop in today and give you some updates on what's going on with the OFA versus the FDA case. Let's give it a few minutes. Actually, Lorraine may be walking in right now. Here she comes. Lorraine.
What is happening?
Well, we're live right now.
Oh, hey. Hey, y'all.
Jazzy MDG's there. Say hello, Jazzy.
I just did Zumba on the deck. I'm a little sweaty.
She's a little sweaty. So we're going to do some news and we'll let her hang out in the background. But let's get a few more people on here. Hello, everybody. All right. We're actually in the room. I wandered around the ship trying to find a good place to film from. Thank you, darling. And there was music everywhere. You know, YouTube likes YouTube likes that. I don't want to pay Phil Collins for news music, so it's all good. Yeah, absolutely. So let me see here. Let's flip over the screen and get this up, and I'm going to kind of walk through and tell you guys what's going on. So as I said, the FDA just dropped a bombshell in the OFA versus the FDA court case, arguing that compounded tirzepatide should be shut down because there's no longer a shortage. Nothing new, right? We knew this was going to happen. And they've been arguing that for a while. This is just that continuing step in the court case. But patients and, of course, the Outsourcing Facilities Association, or the OFA, say, that's not the full story. Many still struggle to get Mounjaro and Zepbound due to cost and access barriers. So stay with us as we break down the latest court filings, what this means for your medication, and whether compounded tirzepatide is really at risk. If you're new to our channel, I'm Christopher Durham, and you saw Lorraine come in. And we are the Downsized. My wife and I have been on an incredible adventure with GLP-1s, Zepbound, Mounjaro, and compounded tirzepatide. So I've taken the gamut. And together we've lost more than 145 pounds. But along the way, we've learned that the world of obesity treatment, that the world of healthcare, it's really not just about medication. It's about access, affordability, and a system where Big Pharma and the FDA make decisions that impact millions of us who are trying to treat our disease of obesity. Before we look at the breaking news, a quick but important note. I'm not a doctor, also not a lawyer, and nothing in this video is medical advice. If you're on GLP-1s or considering them, please always consult with your healthcare provider to determine what's best for you. Every person's medical needs are unique, and it's crucial to work with a professional who understands your specific health situation. Also, before we jump into the news, make sure you like this video and subscribe to our channel. We just topped 10,000 subscribers, so thank you very much out there. If you've been part of this journey all along, we appreciate you. Or if you're brand new, hello, nice to meet you. We appreciate you as well. If you want to stay up to date on everything happening with GLP-1s, access, pricing, shortages, and of course the latest on compounded medications, tirzepatide and semaglutide, hit the notification bell so you don't miss our updates. And of course, today we've got some breaking news. This happened just yesterday. The FDA just filed a major response in the Outsourcing Facilities Association's lawsuit over compounded tirzepatide. Well, of course, the FDA is doubling down and saying, you know, their decision was correct. They're saying there is no shortage and that compounders should stop making the medication. If the FDA wins, compounded tirzepatide could be off the market permanently, or certainly be a lot of regulations around it, and we'll go into that in just a minute. We're going to break down exactly what the FDA said, how they're defending their decision, what the OFA argues in response, and what this, of course, means for you. But it's been a big week in court filings as we've been sailing around the Caribbean. Various people have been filing things. Most of it's not new, but it's interesting to note who the players are and what they've said. So earlier this week, of course, Eli Lilly submitted its response to the case, sticking to its now well-worn argument, compounded tirzepatide is a threat to its patents and its profits, and of course, is risky for patients. Lilly continues to push the narrative that any tirzepatide product not made by them is unregulated, unapproved, and potentially unsafe, despite the fact that, as we know, hundreds of thousands of patients have successfully used state-regulated compounded versions safely. But let's be clear, this isn't just about safety, it's about market control. By eliminating compounding, Lilly ensures there's no competition, no alternative pricing, and no patient choice. And now with the FDA, of course, continuing to back their position, they're one step closer to making this a reality, so we'll see. Also earlier this week, Novo Nordisk entered the chat. So they filed an amicus brief in the Northern District of Texas court, to the court where the OFA and the FDA is fighting it out, supporting the FDA and Eli Lilly in their legal battle against the Outsourcing Facilities Association. If you're not a lawyer, which I'm not a lawyer, so what is an amicus brief? Well, an amicus brief is short for amicus curia, which is Latin for friend of the court. So it's a legal document filed by someone who is not directly involved in the case, but has a strong interest in its outcome. These briefs are used to provide additional information, expertise, or perspectives that may help the court make a more informed decision. In this case, Novo Nordisk is using the brief to argue that state-regulated compounded versions of GLP-1 medications, like semaglutide, pose significant risks, safety risks, they say, due to the lack of FDA oversight, potential impurities, and improper dosing. The company, Novo Nordisk in this case, emphasized that its FDA-approved semaglutide medications, Ozempic and Wegovy, have undergone rigorous clinical trials, whereas compounded versions have not. Novo Nordisk also accused compounders of exploiting the FDA's drug shortage list to market unregulated, potentially unsafe alternatives to patients. This position is no surprise, as it aligns with the company's ongoing efforts to protect its patents and profits by restricting access to compounded versions of its medications. So although the OFA versus FDA case is not directly related to compounded semaglutide, Novo Nordisk's involvement suggests that it sees this lawsuit as setting a precedent that could impact the regulation of its own drug. The brief criticizes the reliability of data used by compounding pharmacies to justify continued production, calling it anecdotal and unverified. Novo Nordisk claims that compounders are perpetuating the perception of a shortage to continue selling state-regulated compounded versions of semaglutide, even though the FDA has listed all official Ozempic and Wegovy presentations as available, and that's a little bit of an overstatement. They haven't quite come out of that. Novo Nordisk has told the FDA that it's that it's currently in stock. The FDA has not confirmed that, so it's weird how the site works. The company argues that compounded drugs do not undergo the same level of quality control, which could lead to contamination, improper dosages, and adverse effects. Novo Nordisk urged the court to reject the plaintiff's attempt to block the FDA's oversight, claiming that maintaining strict regulatory control is essential for patient safety and the integrity of the drug supply chain, while also ensuring its own exclusivity in the marketplace. Before we jump into the rest of the story, let's see who all's out there. Lots of people out there. So 117. Hello, everybody. Watching this from your recliner. I see lots of folks out there. Hello, everybody. All right, let's jump into the rest of the news here. So the breaking news. So as I said yesterday, the FDA filed an official opposition to the OFA's lawsuit, which seeks to keep compounded Tirzepatide available to patients. In their response, the FDA defended their decision to remove Tirzepatide from the national shortage list, saying that they carefully reviewed the supply and demand and determined that the shortage had been resolved. The FDA claims that Eli Lilly is now producing enough Mounjaro and Zepbound to meet all patient demand, with a surplus in reserve. They argue that the shortage period is over, and therefore compounding pharmacies should no longer be allowed to make and sell Tirzepatide products. Here's a direct quote from the FDA's filing. After considering evidence from multiple sources, including data provided by Lilly and information submitted by plaintiffs and individual patients and pharmacies, the FDA determined in December 2024 that the Tirzepatide shortage was resolved. And to back up their decision, they say, the FDA correctly evaluated Lilly's detailed information about its supply and demand, which demonstrated Lilly is fulfilling all orders while maintaining a surplus. So essentially, they relied on the manufacturer's data. Now, here's where it gets even more interesting. The FDA also acknowledges that they were aware that compounding pharmacies were producing a high volume of Tirzepatide, but they say that even with that demand, Lilly's supply is strong enough to handle any increase in patients transitioning from compounded products to branded ones. They even admit that patients are using compounded Tirzepatide because of pricing issues, but argue that price is not a factor in determining a shortage. According to their filing, a shortage does not exist for FDCA purposes every time patients cannot get the product for any reason. Silly me. I thought if I couldn't get the product, that was a shortage. Well, of course, the OFA and patients like you and I disagree that the shortage is really over. The OFA, which represents 503B outsourcing compounding pharmacies, argues that the FDA is ignoring real-world patient access issues. Just because Lilly reports that they have a surplus does not mean that patients can actually get the medication. So let's break it down. Patients and pharmacies are reporting certain doses of Mounjaro and Zepbound are still backordered at retail pharmacies. Insurance companies are still blocking access with denials and prior authorizations. And even if Lilly has a surplus, it doesn't mean all patients can afford the drug. So we're getting reports every day from you guys all over the country saying that you cannot get your medication. We're even seeing screen captures and reports from Lilly Direct saying that they're out of stock. So not sure what's happening there. The OFA's argument is simple. A shortage isn't just about whether a company says they make enough. It's about whether patients can actually access the medication. And honestly, isn't that what the FDA is supposed to be doing? It's supposed to be protecting American patients. They also point out that the compounded Tirzepatide has been filling a massive gap in the market, allowing patients who otherwise can't get Mounjaro or Zepbound to continue treatment. And here's a key point from the legal filing. Even assuming that all of these doses have been supplied to the market, and upon the curtailing of compounding would translate to demand for Lilly products that would represent a very small amount relative to Lilly's reduction in inventory. In other words, the OFA believes that Lilly's surplus claims don't match reality. Well, if you guys have watched Lorraine and I very long, you know this isn't really just about a legal battle for us. It's personal. We have both taken compounded Tirzepatide and relied on it to fill in the gap when Eli Lilly simply could not do it, or honestly, when we had to pay out of pocket, which we have had to since the very beginning and could not afford it. Like so many of you, we could not get our medications. I could not get my Zepbound or Mounjaro from the pharmacy on many occasions. I had the exact same results regardless of whether it's Mounjaro, Zepbound, or compounded Tirzepatide. Confirms what many of us already know: compounded Tirzepatide works. And today, Lorraine still is using compounded Tirzepatide, and so am I. Well, why? Because it's the best option for us right now. We're not alone. So many of you are still using compounded versions because supply issues, insurance denials, or cost barriers make it the only effective way to treat your disease. This case isn't just about paperwork. It isn't just about patents. It isn't just about profits. It's about you and I, real patients, whether they'll have access, whether we'll have access to the treatments that we need. So we have to stop and say, what's going to happen next? Well, the court will review the FDA's response and decide whether to block the agency's decision. If the court sides with the FDA, compounded Tirzepatide could be stopped at 503Bs, those larger compounding manufacturing facilities, and it could be seriously limited at 503As who work with the FDA within the FDA regulations. So, of course, we know a lot of the 503As believe they have a legal path to continue manufacturing the drugs, whether it be with different dosing, whether it be adding different vitamins. So inevitably, there's going to be more legal court cases. Our compounding or our telehealth provider, our compounding pharmacy believes they can continue so much. He does believe they can continue, but we'll see. Again, not a lawyer, so don't know how this all plays out. If the court sides with the FDA, if the court sides with the OFA, compounding may continue at least temporarily. This case could take months, if not years, and appeals are likely. The only thing that's guaranteed is lawyers are going to make more money in all of this. Given the existing timetables from the court, we will most likely see something from the judge on the preliminary injunction within the next week. So if he declares the injunction, compounding will continue. And we will see what happens. It'll go to court. He'll have to figure out all of it, but who knows? It remains to be seen. The big question here is simple. Is the FDA making this decision in the best interest of patients, or is it simply protecting Eli Lilly's monopoly? We'll let you decide. We want to hear from you, of course. Have you had trouble getting Mounjaro or Zepbound? Have you used compounded Tirzepatide? Drop a comment below and tell us about your experiences. Tell us about what's happening out there. So let's see who's out there. Do you have any questions? What's going on? Honestly, this isn't the biggest breaking news. There's nothing great no big great changes happening here other than the court cases continuing forward. The FDA reaffirmed its decision and said, okay, judge, now tell us if there's an injunction. So let's take a look who we have here. Oh, Jazzy, we talked to you. Hello, Mia. Lots of folks out there. Denise Walker, hello, and Denise Penny. Hello, everybody out there. Looks like we've got 170 people watching. Make sure you like and subscribe. Hello, Woodkirk. Haven't seen you in a little while. Barb from Health at Any Cost says hello. Rita Glengarry watching me from my recliner where it's 11 degrees outside this morning and snow on the ground makes your cruise sound really good. So you guys should come with us on the cruise in June. VS006 says, hi, Christopher Lane. Oh boy, here we go. Lots of people in cold weather. -13 in Iowa. Ooh, I think it's 80 degrees here in the Caribbean right now. VS006 Val says there's definitely a shortage. That's why I failed Saxenda last year. It was never in stock and I missed doses on a regular basis. Make sure you're reporting it where you can. There's a link on our website at thedownsized.org. If you go to the resources page, there's a link to the FDA site. Let's see here. Some glutide is now listed as resolved on the app. Okay, I'll have to go check that out, Janet. Thank you. Let's see here. Of course, they have to exclude compounded. There's way too much benefit from this drug, and we all know big companies need more money. Well, remember, the compounders aren't small companies either. Let's see here. I just looked, and you are absolutely right. Looks like it was changed not too long ago. Oh, okay, they're looking at so there. You guys are a step ahead of me. That's good. Let's see here, Jay Campbell. I just got approved for Zepbound because of my sleep apnea. I've been paying for compound out of pocket for the past 6 months. I'm happy I finally got approved. That is awesome. It's good to see the other comorbidities doing it. Tracy Gross Design says my pharmacy was out yesterday. BS006 Val says they can't handle everyone getting meds from them, and there's absolutely a pricing access major issue. For sure there is. Chasing Sunshine, Carolina RX states at the top of their pharmacy page about the shortage. Yeah, I mean, I think everybody but FDA and the Eli Lilly thinks there's a shortage. Turning off the sage. So does this mean compounding will not be available? This means that it will continue to be available as long as the court case is going on, but until the judge makes some sort of decision, we won't know what the timetable will look like. Probably that decision on the preliminary injunction will happen in the next week, probably by the 25th, if I had to guess, based off of their timetable. Turning the sage. I think I talked about Mochi, but how about Mochi? They say they have a legal path forward. We'll see how it goes for them. We sure hope so. Health at Any Cost. Barb says, blessedly, I have had 0 issues getting my 15 milligrams. That's great, Barb. Turning the Sage says, I don't think the branded drugs are affected. Just right. So this whole conversation is Eli Lilly and Novo Nordisk will continue to be able to make their branded drugs. This has nothing to do with them servicing that. It has to do with whether they're in stock, and if they're not in stock, then theoretically compounders can continue to manufacture compounded drugs. Let's see here. African and Blessed to Travel. Thanks for being a member. African and Blessed to Travel. Eli Lilly, please just bring the price down to where it's comparable with Mochi. Most of us will flock to buying from you. I think ultimately that will be the answer. I mean, a lot of people disagree with me, but I do think the cost will come down. Honestly, I think eventually Wall Street's going to say you guys have to hit numbers, and the only way to hit the numbers is to lower the price and increase your volume. So 503B will sell stock after stop order up to bud date of stock. Yeah, absolutely right. So I mean, if you've got orders in, they'll still continue to fill them. Joe Langan, I couldn't get Wegovy a few weeks back out of my local Rite Aid. Couldn't afford it anyway. As I'm on Medicare, I'm on compounded Tirzepatide. It works wonders. GLP-1 journey and review. I hope compounds don't go up. I don't think they're going to go up in price anytime soon. See here, YouTube user. I retired at the end of 2024, went on Medicare, so I'm using compounded Tirzepatide. I was on Wegovy for 22 months, lost 90 pounds. Would like to lose more, but would be happy to get back to maintain. Well, good for you, man. 90 pounds is great. Here comes Lorraine sneaking past. Say hello, Lorraine. Elizabeth says most of my local pharmacies don't have Wegovy. Lily Mittner says, what does the cost compare with the compounded Tirzepatide? So if you get compounded Tirzepatide from our provider, which we use Mochi Health, Compounded tirzepatide is $199 for all doses, so all the way up to their 16.6 milligram. They have a slightly different dosing strategy, and then they have a $79 a month fee. So if you're paying full price, if you're a Medicare patient, you're paying $1,000 plus, or maybe you're on a 650 coupon, so it's significantly cheaper. Let's see here. Joe Langan says, I need compounds due to my nasty side effects and need lower doses. So Joe, that's one of the things that the compounders will be arguing, is that because of the flexibility, they can create medications that work better for you. And they have lawyers that believe that should, I mean, to me, not a lawyer, that seems to work into the regulations that the FDA has out there. Janice Kitchen says, I have had issues getting it from Zepbound from CVS. Yeah. Chasing Sunshine says, Lorraine just stopped in the shower. Alcy Craig says, what is the percentage of compounded medication to branded? There's no way to know that for sure, Alcy Craig. There's nobody tracking those two numbers for certain. We know there's hundreds of thousands. If you believe the OFA's numbers, it could double or triple that. There's no single person or company or organization tracking all of that, so it's hard to say. All right, so that is us for today, giving you the update. So the update is the FDA said, yeah, we still agree with our decision, and we're going to back it up, and they kick it back to the judge. The OFA will have, I'm sure, something else to say to that. Novo Nordisk weighed in and said, yeah, we think the FDA is right on this, and these meds are dangerous. You and I, of course, know our stance on it. Lorraine and my stance on it is I have taken Zepbound, Mounjaro, compounded tirzepatide. They've all worked well for us, no issues whatsoever. I do believe that Lilly and Novo Nordisk should bring down the prices, and honestly, I'm not loyal to any one of them. I'm happy to have these GLP-1s and would take whatever works best at the best price. So if Lilly could get it to, $100, $200 a month every day, I would never take another compounded shot in my life. I do like the vials and the flexibility of it, so I do believe that Lilly should release all the doses in the vials, and that could alleviate a lot of the problems. And then we're very, very hopeful for a lot of the new medications coming up, retatrutide or forglipron. There's another 600 medications in development out there. So I think a year from now, 2 years from now, the landscape of GLP-1s and the treatment of the disease of obesity is a completely different place. We'll have a lot of options. Hopefully pricing comes down. And, with the continued conversation, it continues to normalize the conversation around the disease of obesity, and makes it a regular thing for us to actually treat it. So nothing to be ashamed of, which is a great thing, because as we repeatedly say, this is the treatment for the disease of obesity. It is not a cure, and this disease is not your fault, and these medications can help. So talk to your doctor, see if it's something right for you. As I've said before, make sure that you're talking to your doctor. We're not doctors. We want to make sure that you get taken care of. All right, let's see if we got anybody else, and then I'm going to get out of here because I'm on a cruise. Let's see here. Yeah, oh yeah. Thank you, Barb. Please hit like and subscribe. We deeply appreciate it. I wonder how many we have. How many likes and subscribes do we have out there? 71 likes, 201 current people watching. If you can take a moment and hit that like and subscribe, it helps. It lets YouTube know that you can share that it should share all of these things. Fimo says, I'm on retatrutide, Eli Lilly, lower my blood pressure and A1C. Hopefully I can get it after the trials are over. You're in the trial. That's awesome, man. Joe Langan says, thank you so much for an adorable couple. Thank you very much. Alcy Craig says, once compounding goes away, do any of these branded meds go into shortage again? Well, I mean, that's the presumption. I mean, just as soon as, I think there's probably a lot more people out there that are on these that will not be able to afford the $650 to $1,000 plus a month to jump over. So I don't see everybody shifting. It's just not going to happen. But some percentage of it will. Now, the reality is, given that Eli Lilly has basically accepted the number, or I'm sorry, the FDA has basically accepted Eli Lilly's numbers at face value, and doesn't seem they've done a whole lot of research beyond that. I don't know that Eli Lilly's going to ever say we're out again. because it tanks their stock price. But we'll see. It's hard to say what's going to happen. Jazzy MDG says, "Congrats on your 10,000 subscribers." Well, thank you, Jazzy. It's we started this a little more than a year ago in March, and certainly never imagined we'd have this response to it. And we deeply appreciate everybody out there. If you're a subscriber, thank you very much. If you're a member of Club Downsize like Jazzy is, thank you very much as well. If you'd like to join, there's a join button below that just kind of helps support the things we do. And there's a lot of members on here. Deb Zimmerman's a member. Barb's a member. So thank you guys. We deeply appreciate it. All right. Well, that is me for today. We will be back, I think, next week. We're going to be live. Our normal live will shift to Tuesday night, and we'll also do a Club Downsize live on Tuesday night. And, of course, make sure you check out our weekly weigh-in on Sunday, the news on Monday we do every week, and then there's something new happening every day. And we try and publish every day. So we appreciate you guys for watching. Make sure you hit like and subscribe. Let me see how many likes and subscribes we have out there. 173, 92. Only 8 more and we'll get to 100. Surely there's 8 more people out there that can hit like and subscribe. All right. Tiffany says, "Have a great time, guys. Let's pray they don't shut the compounding completely down. I'm down 57 pounds and have 40 to go. Safe travels." Absolutely, Tiffany. I agree with you. Elizabeth says, "I subscribed when you guys just had a few videos out. So nice to see how much your channel has grown." Thank you, Elizabeth. We appreciate your support. All right. If we can we're almost there. I'm going to hang around until we get to 100. There's 95 right now. Come on. There's 5 more people out there that can hit like. I know it. We've got we're going to do a pool day and I'm going to go sit in the jacuzzi for a while. We're on the celebrity reflection. Let's see here. Oh, Barb at Healthy and Any Call says, "Hims and her stock is falling." Yeah, that doesn't surprise me. Oh, Biggie ass no more, dude. Hello. Lilly and Novo will sue the FDA to enforce the law. As for Mochi, it's alternate doing, not custom. That avenue won't fly until they say, "Joe, you need 1.5. Mary, you need 8.14, etc." Yeah, I don't know whether it'll fly legally either, Piggy. Honestly, I think it's just there's gonna be a whole lot of lawyers that get paid over that. Although we have a tendency to believe compounding is really just about semaglutide and tirzepatide and GLP-1s. It's not. The compounding industry has been around for 100 years. Your local pharmacy, our guy's name is Neil, has been doing things like this for a long time. So it's not outside the realm of possibility, but I'm not a lawyer. I certainly can't tell you the way it's all going to play out. Lily is saying compounding is not safe because they know the shortage argument isn't valid. Brian, you're exactly right. Corrine Wilson says, "I'm subscribed from the UK, although our rules are very different." Well, Corrine, we try and track the UK too. So there's a lot of stuff going on there. I've got a couple stories in the news that'll be about the UK coming up. I guess your NHS and stuff just released some various things. Oh, here comes Lorraine in pink. She's changed her clothes. Yep. Yeah. Joe Langan plus other meds are coming out. So I was hanging out till we got 100. Let's see if we can get we got 109. Woo, 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 woo. All right. Dance break, Lorraine.
I did Zumba. Anybody out there Zumba?
Anybody out there Zumba? Piggy, say hello to Piggy.
Hey, Piggy. Oh, thanks for the super chat, man.
Let's see here. All right. Yeah, Piggy, we always appreciate your support, man. Thank you very much.
I'm not on the snooze broadcast today because I'm just envisioning compounding will be here forever. And Mochi says not to worry. I'm not going to worry. But thank you for watching today. We appreciate it.
Absolutely. All right. That's it for us today. Thank you very much for being a part of the Downsize. If you haven't already, hit like and subscribe. And we'll see you next time. Hopefully there's no more news today. But, you never know. Maybe the judge will come back and say, "No, it's okay." And if he does, we'll be back. All right, guys. Thank you very much for being a part of the Downsized. We'll see you next time.